Well, joining me now from Raleigh, North Carolina is Dr. Krishna Udayakumar. He's the director of the Duke Global Health Innovation Center. Welcome to the program.
Thank you.
So, the Johnson & Johnson vaccine is to be administered again. The one-dose shot was meant to be a game changer, but with this big warning label, do you see it playing as big a role in U.S. vaccination campaigns?
Yeah, in the U.S., I think we have the privilege of not being critically dependent on the Johnson & Johnson vaccine. We know that we will soon have enough doses of the mRNA-based vaccines from Pfizer and Moderna to cover every adult and probably every child 12 and up over the coming months as well. It's important to have the J&J option as well because it's a single dose. It doesn't require as onerous a supply chain, including cold chain management. And so for hard to reach populations, hard to reach locations, it's going to be really important. And of course, having a backup for potential emerging variants is also an important reason for it. But I don't see the J&J vaccine playing a critical role in the vaccination campaign in the U.S.
And then there's also the question of confidence, right? What will you say to someone who is hesitant to receive the Johnson & Johnson vaccine?
I think we should take confidence in what was done over the last 10 days, that between the FDA and the CDC, we have an incredibly strong regulatory oversight system as well as safety surveillance system that was able to pick up a very small safety signal, chase down the data in a very short period of time. And what was really great today was a very open, transparent discussion. All the data was available, the slides are online, and we now know exactly what the risk is. And we were able to follow in real time as experts were able to discuss the benefits and the risks. So all of that together, if we continue to communicate in an open way, should allow us to continue to have confidence in this vaccine.
Right, so it's actually a good thing. I want to go, look at the global picture for a moment, if you don't mind. I mean, India just had another day with over 330,000 cases in 24 hours. Hospitals are buckling under pressure. Oxygen supplies are depleted. How concerned are you by the situation there?
Very concerned. What's happening in India right now is tragic and unfortunately getting worse by the day. We see the number of cases continuing to skyrocket, the world record being set for daily cases the last 2 days on the way up. We're starting to see positivity rates of testing above 18%, which means we're not recognizing as many of the cases as there actually are. Deaths above 2,000. I think we're going to have to see some more drastic measures, including lockdowns, to really turn the corner here because the health system is buckling under the pressure.
Right. Now, and Doctor, India is, as we are talking about, suffering from surging infection rates, while Brazil is plagued by mounting deaths. Are we seeing trends of why these two countries are being hit so hard now?
I think what we're starting to see is that leadership really matters, that you've got to take this very seriously. There has to be a coordinated approach that includes strong public health measures, including social distancing, masking, what we've seen in India in terms of large-scale gatherings for election rallies, for religious types of events have turned into super spreader events. And we've seen senior leadership in both of those countries, in India and Brazil, not take this pandemic seriously enough, and their populations are suffering as a result.
I think we can say the same about this country at one point in a different administration. Meanwhile, as the world population, more of the world population gets vaccinated and people try to return to some semblance of normalcy, what's the risk of new waves of infections? I mean, even here in the United States.
Yeah, the risk is that we get complacent. I think what we've seen in terms of a positive scenario is what's happening in Israel, where they've had massive vaccination campaigns. They are starting to return to normal. We would all love to do that. We've also seen examples of countries return to something close to normal without having to resort to vaccination. So there are different approaches that can lead us back to a semi-normal approach to going out and reopening the economy. But what we can't afford to do is start to get complacent and loosen our approach before we really have vaccinated something close to herd immunity, or before we've gotten the rates of cases down low enough that we can start to reopen. So I think we are in a very vulnerable period of time over the coming weeks and months where people have fatigue, but they need to stay really vigilant until we really turn the corner.
Important advice. Dr. Krishna Udayakumar, thank you so much for your time.
Thank you.